Today, in this presentation, we are going to discuss the health sector strengthening. Does financing really works? During my last 2 months approximate stay in United States, especially in Texas and Florida where I traveled, I tried to understand the patient satisfaction in United States. I tried to study and compare the satisfaction level of India as far as patients are concerned, and I tried to study and understand some of the countries where the per capita expenditure on health is not that much in comparison to United States of America, but yes, of course, the much more than uh, India. Some of the facts I want to share with you before we exactly go to the issues of access, quality, and patient satisfaction. The global healthcare and wellness industry nowadays is approximately of $4,886 billion and will be 7,656 approximately $billion by year 2030. So I want to uh, share that how important is the healthcare industry across the globe. The United States spend up to 16.8% of its GDP, probably the highest in the world, on healthcare, much more than best healthcare countries as far as the access, quality, equity, and healthcare delivery is concerned. Most of the countries are spending 8 to 11%. That is Germany, France, Brazil, Netherlands, New Zealand, all countries. India spent more than 2%, that is approximately around 2.5% of GDP on healthcare industry. So this is basic. I want to make you know that whether the healthcare industry money spent on healthcare industries really addresses the issue of quality healthcare delivery. It is up to you to decide whether yes or no. What you say as far as the cost and the patient satisfaction is concerned. Healthcare industry globally, some of the facts hospital administrators, health and hospital managers should know that it is the third largest employer in the world, the largest employer of the woman manpower in the world. The nursing professions are highest female in the healthcare industry. Unskilled jobs for women are much more in healthcare industry. Revenue and manpower requirement is unmatched as far as healthcare industry is concerned. US and India amongst top pharma industries. In spite of that, the cost of the medicines are not to the extent they should be in both the countries. Fastest growing profession in USA is the nurse practitioner. So these are some of the points I want to share with you, that how important the healthcare industry globally is, and how to understand it as far as the expenditure and quality is concerned. When it comes to the bed strength in India, the approximately 714,000 hospitals beds over 69,000 hospitals in India. That is 1.4 bed per 1,000 population. Indian cities having highest hospital bed numbers are in following order. That is Pune, Ahmedabad, Bengaluru, Mumbai, Hyderabad, Chennai, Kolkata, and Delhi NCR. 69% of the hospital beds in India are in urban areas. So this is definitely, we have to understand the urban rural unmatched in India. WHO recommends 3 beds per 1000 population, and it will take long time in India to come to that stage. I tried to understand the issue of access in healthcare industry in different countries. The Netherlands tops and the United States is at 11th number. So what I want to highlight is that does the per capita expenditure on health addresses the issue of access, or there are some other factors which are addressing the issue of access. 100% insurance is required in Netherlands. When it comes to the affordability, UK tops and United States again is at the 11th rank. So we can understand that only healthcare financing doesn't increase the accessibility and affordability. Brazil constitution provides total free healthcare to its citizens. And even if I go as a visitor in the Brazil, and if I need the healthcare services, of course they are free for me even as a visitor. United States, the preventable diseases program and preventive measures are definitely ranks number 1 in United States. So they are making more expenditure on prevention of the diseases rather than healthcare delivery. Next comes the United Kingdom and Sweden as far as the preventable diseases program are concerned. Under the head of the administrative efficiency, Norway, Australia tops the list. So definitely the administrative efficiency have an edge above the financial expenditure in healthcare delivery. When it comes to the equity, income related disparities least in the New Zealand. Everybody has right to reach to the hospital and have access, whereas highest in the United States among all the high income countries. IMR in USA is 5.74 per 1000. Life expectancy after 60 years is 60 plus 23.1 years. That is 83.1 years. And it's to our surprise that the life expectancy has reduced in some of the population group by 3 years in United States. In last several years, it has been observed. So maternal mortality rate in the United States of America is 17.4 per 1000 live birth, whereas in France and Germany, 7.6 death per 1 lakh live birth, and they are spending around 8 to 11% of their GDP on healthcare. So when it comes to access, when it comes to equity, only the healthcare financing doesn't work. So here what I want to suggest is that policy changes within and beyond are required. Provide universal health coverage, which is must for any country. Invest more and more on primary health care so that quality health care is available at remotest area of the country. What we suggest that there should be the service norms, there should be manpower norms, there should be equipment norms, there should be, availability of medicine norms at every level, that is primary level, secondary level, and tertiary level. And as per the norms, we should provide the manpower, we should provide the investigation facility, we should provide the healthcare delivery. Reduce administrative burden on patient as well as on clinicians, which is must, so they can have more time for clinical work. We should think in terms of investment in social services and increase equitable access to nutrition, education, child care, community housing, transportation, safety of healthcare workers and their benefits, increased access to care requires expanding and strengthening of insurance coverage. Even in the United States of America, they have not yet reached to the extent of more than 90% of insurance coverage. So this becomes big problem when it comes to the emergency room care. When some patient goes to emergency room in United States of America, at least the treatment is being done free of cost. But after that, he has to pay the uh, bill of the hospitals, either in the form of installment, or his guarantor pays, or in any way he has to pay. Netherlands general practitioners has to provide 50 hours per year after hours care, that is after 5 p.m. In the evening and up to 8 a.m. in the morning. This is one of the concept how the availability of doctor in the night or nurse practitioner in the night can be achieved. There is a Patient Right Act in Norway. Although the healthcare services are not free in the Norway, they have to pay approximately $220 per year. But once they have paid, then almost every healthcare requirement of the patient is free across the country. Should think in terms of reducing the administrative burden. More time for clinical work should be permitted to the clinicians. So, in my opinion, a take home message for hospital managers, hospital administrators, politicians, policymakers, healthcare financing uh, persons who are addressing the issue of healthcare financing, they should think in terms of smarter spending, not more spending. So, more spending doesn't addresses the issue of quality, the issue of access, the issue of equity, the issue of affordability is not being addressed simply by more spending. It is being addressed by more smarter spending, that is addressing the issues which are affecting the health care of the person. Thank you very much.